Joe Mangano, Executive Director of the Radiation and Public Health Project. Next on Enviro Close-Up. Catastrophic accidents at nuclear power plants are horrible enough. Fukushima, Chernobyl, 3 Mile Island. But in fact, even without a catastrophic accident, nuclear power plants spread death and illness. Joe Mangano, Executive Director of the Radiation and Public Health Project.
Over time, it seems like the greatest health concern from nuclear reactors has been catastrophic meltdowns like at Chernobyl and Fukushima and 3 Mile Island. Even though that's true, that doesn't mean you need a meltdown to threaten the health of people living near reactors. And this is because when a reactor operates on an ongoing basis, it creates over 100 man-made radioactive cancer-causing chemicals. A lot of it is stored as waste. However, some of it, as a condition of operating a reactor, is released into the environment, into the air and the water, and thus into the food chain and people's bodies. And what are the health consequences of it? The group Radiation and Public Health Project was founded in 1989 really to address this very question. Because in all the years of operating nuclear reactors, which began in the 1940s, there had only been one national study of cancer near nuclear plants. And we felt this was done purposely to hide potentially high levels of cancer. Since then, our group has published 37 medical journal articles, 8 books, and done 29 press conferences on this particular topic. To summarize what we found, in most cases near nuclear plants, we find that when you open a nuclear plant, the cancer rate in the local area increases. We also found that when nuclear plants close, in the first year or two, there's an immediate and definite decline in infant deaths and cancer cases in children 4 and under. These are the ones who are the most sensitive to a dose of radiation, the fetus, the infant, and the young child. We also have gone out and done the only study of testing how much radiation is in people's bodies. We call this the Tooth Fairy Project, which sounds like a fun exercise, but it's really a serious piece of science. It's been done by other groups going back to the 1950s. And we went out and collected 5,000 baby teeth and sent them to a laboratory where they tested them for one of the 100+ chemicals called strontium-90, which doesn't exist in nature. You only find them when you explode an atomic bomb or you run a nuclear reactor. And the 5,000 teeth were mostly near 6 nuclear plants. We found that from the late 80s to the early 80s to the late 90s, the amount of strontium-90 went up about 50%. We found that the closer you got to a nuclear plant, the levels of strontium-90 were about 40% higher than in areas away from any plant. And we also found a link with childhood cancer near several plants. When the strontium-90 rate went up, the childhood cancer rate went up. When the strontium-90 rate went down, the childhood cancer rate went down. 2 lines on a graph that look almost identical. So really that is the biggest contribution I think Radiation and Public Health Project has made. That yes, a meltdown is a great concern, but while we're waiting for a meltdown that hopefully will never happen, people are in fact being harmed, and thus we need to adjust policies to reduce the amount of radiation being released and really to close reactors.
The Radiation and Public Health Project has been a pioneer for decades in exposing the reality that nuclear power plants spread illness, spread death, and they all should be shut down. I'm Karl Grossman.